So, let's see. Very wide gait. And exercises you guys find was going well?
Yes. Sometimes he has bad days.
Yeah.
But today seemed like a good day, where his mobility was okay.
Good.
His standing was okay.
Good. Your little pelvis, hey bud?
And Sandra mentioned that his pelvis was not aligned or
Yeah.
something.
Yeah, she had noticed that it was his left one.
Okay.
Yeah.
It's okay, Pepper.
You're doing so good, Pepper. Not a ton of hip extension, hey bud? Okay. Good job.
It's okay.
He's so cute.
Thank you.
You're so curly. Hey. Good job. A little bit tender, hey. Good job. It's always fun to adjust your pressure after you've seen a Rottweiler to a little guy.
Oh.
Hey. Oh, there they go. Oh, good, bud. There we go.
What does that thing do?
This is an alpha stim, so this helps calm them. So when they're a little bit anxious, it basically sends a current from one to the other, and it just kind of helps settle them, especially with treatment because it's a little bit overwhelming. So yeah, it kind of just helps through that. Sends a little current.
Can they actually feel it?
Yeah, it's kind of like they basically use it for people a lot of the times with insomnia and stress and stuff like that. But we find it really helpful in these little guys. Just kind of helps calm them and soothe them a little bit. Good job.
We were wondering,
Yeah.
have you heard of the Dr. Ho?
Yeah.
Is that okay for dogs at like a very low setting?
You can do typically we do like muscle stim and stuff like that to help kind of improve muscle tone. I mean, it could help a little bit from like the pain standpoint. I'd almost be more inclined for one of the electromagnetic fields that can help. So basically you can kind of pop it underneath their blanket and it kind of helps from like a healing standpoint. It helps with pain relief. So that's typically what these mats underneath do. But we have like small like ones for home out front too. So that can be like sometimes helpful just to kind of help with, you can pop it right underneath their dog bed.
Okay.
Yeah, the Dr. Ho, I mean, it can sometimes when you're actually like applying it with like the gel and stuff, and if they're anxious about it, it's more of a hassle to try to get it on these little guys. But you can typically put it on like a low setting, almost like an acupuncture stim. So it'd be more of like your 4 hertz setting, so quite low. Yeah.
Sandra mentioned that he has a knot in his left
Shoulder?
Yeah.
Yeah.
I don't know how to feel it. Could you show me later?
Totally.
And we were
We can
thinking
totally
maybe
do all that.
apply it there, because I've been trying to massage it, but I don't know if I'm even doing it right.
Right, yeah. We'll go through all that.
Thank you.
No worries. How'd you guys hear about us?
Facebook.
Facebook?
Yeah,
There you go.
I posted
Hey,
something
Pepper.
on the Facebook group, and I asked where I can purchase CBD oil.
Oh, okay. Yeah, you're like,
Came
what?
here.
Good. And you found out all this stuff. How's the CBD been?
I'm not really sure.
Yeah?
Maybe it's a placebo effect on my end.
Okay.
But also, we have been giving him lots of exercise since seeing Sandra last week.
Good.
But we do continue with the CBD oil.
Okay. Hello. Okay, there you go.
CBD oil did work for him back in June. We used the Brad Patterson.
Okay.
But I think because he has higher tolerance with it, I think it stopped working.
Stopped working.
And if we give him too much of the oil, his stool starts to...
It gets soft.
Yeah.
Yeah.
So we had to kind of stop for a bit.
Okay. Good.
It's okay, Pepper.
Yeah, that's tender. You're doing so good. Yeah. Just kind of mobilizing his ribs a little bit next to his spondy.
Good boy.
Nice and gentle. Hey. Good job. Good. Oh, good boy. And how old is he?
Just a little over 17. 17 now.
You're 17. You're a wise old man. Hey. 17. Okay. Let me check your. There you go. Just checking his hip range and deflection here. Good from a single leg stance standpoint. You're on the move. It's okay. Flick him off again. Almost.
It's alright, Pepper.
Pelvis doesn't feel terrible today. Okay, so the SI joint. A little bit. Localize it a little, but not to the degree that that one looked like when she. So that's good. That would have stuck. What she did helped. Okay. You're on the move again? Okay. There you go.
Pepper, where are you going?
I'm going to check it out. I'm trying to get away from this crazy lady. Hey. Good job. That's so good that you saw good results though.
Mm-hmm.
So did you just find like less tenderness? How did you find
More like
more mobility?
Yeah, more mobility.
Good.
And when we got back home,
Yeah.
he started to doing a lap around the island by
Oh,
himself.
did you?
And he hasn't done that for a long time.
Has he? Okay. Good job.
But Sandra mentioned that I should regulate him, making sure that he's not
Doing too
pushing
much.
himself.
Yeah.
That day.
Yeah. He did a lap of the island. Good. And typically was he more kind of like in his bed?
Yeah.
Yeah. Taking him out to the bathroom and such?
Yes.
Okay. Good job.
So every day since seeing Sandra, we give him exercise 60 minutes all in total,
Okay.
just broken down.
Broken down.
Like
Let's
15,
just
20
see,
minutes.
too, what she had you guys doing. Tail pulls, good. Three-legged stance, good. Skin rolling, good.
This one, it was tough to
Good.
do. Like when I tickled his leg, the way Sandra showed me, he
Yeah.
didn't
Didn't respond?
Yeah.
Okay.
Except for the front left leg.
Okay.
Then he would lift that
Then
up.
he would lift it. Okay.
So another way I've been doing it was just holding his paw to
Yep.
get him to balance on all four.
Which is good to do. Yeah,
Okay.
which is great. The other thing you can do too is a slight weight shift. So when he's standing,
It's okay, Pepper.
there you go, Pepper. You're wagging your little tail. Hi, Pepper. Okay, let's get you in a stance. So, kind of coming behind his hips. You can just gently, literally move him from one side to the other to off weight him. Because he doesn't need much, he's petite. So kind of even just shifting from one side to the other helps weight bear. And then just like you were doing,
It's okay, Pepper.
just like we were doing, if you kind of lift him up a little bit and shift him over, that's weight bear. That's gonna help weight bear on that left leg. And then a slight shift and pick up of that leg and kind of push him a little bit to the right will help weight bear that right leg. So that's as like you don't need to get him to necessarily actively do it on his own. You can assist with that. Oh, come here, sweetheart.
How do we do it for the front legs?
The front legs, similarly. So in a stance, we would get him basically, you can kind of hold a little bit underneath the chest, I find. And then as you pick up this leg, if he doesn't want to bend it right now, you can even kind of just lift him up that way.
Okay.
And that causes him to weight shift onto the front. And then if I come underneath here and lift him up that way, he's weight shifting now to that front right. So it's just kind of taking him underneath sometimes and just letting him off weight that way is the easiest way to do it, I find. Yeah, just to keep it gentle with him. And the same thing, you can come underneath and lift. And I'm only just applying a little bit for balance for him. And then same with the other side, underneath a little bit of balance. And just try to tolerate what he can. He'll let you know, right? And some days are gonna be better than others. Yeah, just like anything. You gonna come over here again?
Oh, whoops.
Oh, the clips are gone, yeah. You can clip them back on.
Sorry.
That's okay. We've put them on like 17 times throughout the treatment. It's not a big deal. Hey, little bud.
It's alright, Pepper.
Now when we do the rolling, a little bit tender there. We feel. You're pretty alert and aware for what's going on, hey?
Yeah. His mind is definitely there.
Oh,
Just the
100%,
mobility,
hey?
yeah.
Yeah. I would agree with that.
I think because of the mobility, he doesn't really eat much.
Yeah.
And also slight depression.
Yeah. Okay, okay. I think that's just a little bit of like fatty deposit that you're feeling, that's all.
Oh, okay.
Yeah.
That's a relief.
Little
Just
bit
that
through
one
there.
spot, right?
Yeah.
Okay.
Just a little bit right there through his paraspinals.
From here. It's okay.
So is this spondylosis? Is it mostly just right in
Yeah.
the center there?
Kind of like where it's roached, right? Right through here. So basically it'll be like a narrowing. And then that's why you'll see him kind of go in. He starts to roach into flexion because it tends to be more comfortable in flexion. It off-weights the spinal cord and then nerve roots and everything. So that's typically why. Hi. Oh, you're going to stand up on my leg? Is that it? There you go. Okay. I'm just going to hug you now. And is this kind of like his first big thing, like with being 17? Has he had any other mobility issues throughout his years?
No.
That's awesome. That's so good.
Actually, no, I'm sorry.
Yeah.
About 3 years ago, he slipped on the laminar flooring and got his hip out,
Did you?
remember? And then
Oh yeah, a couple times, and then he got trouble so.
he couldn't
whenever-
squat.
Yeah, whenever he.
Okay.
It was weird because
Yeah.
we would take him out and then he just kind of just run around.
Oh yeah,
Right.
he was running around, and the vet was saying maybe it was because he was in pain and he didn't know what to do.
Right.
So we gave him, I think Deramax or something that time.
Okay, for the pain and
Yes.
inflammation. Okay.
And right now he's on gabapentin.
Yep.
And another time, pretty much when he was at the groomer, he must have scored where his hip was out again.
Yeah.
Same thing, him running around, and yeah, just rested for 2-3 weeks with Deramax.
Okay. Let's see. Hey, little bud. We'll do 6, I think. Do some laser and calm things down. Great that he responded well to laser. There we go. Hey. This is the nice stuff. This is the stuff everybody likes.
Good boy, Pepper.
You're good. I know. How dare I hug you? How dare I hug you?
So is that one just directly on the spine itself?
This one is, yeah. Yeah. So we go right down I'll go right down the spine, the whole length of it, right now. Into the hips, like SI joint. And I'll probably do a little bit in through the front too. So all good things. And they usually really respond well to laser, especially the older guys. Yeah. Helps really well with like increased blood flow, inflammation. All the good stuff. Hey. This is good. I'm glad that you guys found us.
Mm-hmm.
Make them more comfortable. Hey. You're
It's okay,
okay.
Pepper.
You're okay, Pepper.
He might be uncomfortable because of the sitting position.
Is it? Because he usually prefers to stand or lay?
Yeah, stand.
Stand?
Because, I think Sandra said it's not good for him to sit down the way it's roaching or something like that.
True, yeah. But then also standing fatiguing. Well, we'll let him if he...
It's okay, Pepper.
Hey. Does he lay?
No.
Or not as much?
The only time when he lays
Yeah.
is when we do the rolling.
Okay.
When we get to his neck, he starts to
Lay
lay down. Yeah.
Okay. This is in a sense good though, because in a flex position, when he's in this position and we're lasering it, it just gaps the joints, so it can help with the laser. So, but you can move if you want. I won't pin you. Hey, there you go. There you go. Good job. And then now laying at home, does he lay on like his side to sleep or?
Yeah, we
Yeah.
have to position him in that way.
Okay.
And put some blanket in between his legs for
Okay.
some support.
Okay. There we go. Good job. doesn't have a ton of hip extension. He's really got his hips underneath them. Oh, you lose your barrettes again. There you go. We'll see if we can get in there too with the laser and help loosen some of those hip flexors up. You're okay. There you go. There you go. You're on the move. There you go. Now you're stood against a wall. Hey? There you go. Oh, you lost another one. Hey, where are you going? You're trying to get away from me, hey? The nice thing about this room, though, Pepper, is you can't go very far. It's a pretty tiny room. There we go. Okay. So good. Oh, give me a second. Good job. Yeah. Where'd it go, little Pepper? There we are. Let's hook you back here since you're on the move. Okay. This is good. He's up and on the go, though. Hey. There you go.
Have you worked with dogs his age with spondylosis, like something similar?
Usually a little bit younger. Yeah.
And
He's
you saw improvements, kind of thing?
I saw, yeah, so basically, like, definitely improvements in quality of life from with regards to, like you said, the mobility and pain and stuff like that. The thing is like, with the spine, we can't make changes to the spine, right? So it's more just trying to get the inflammation and improve blood flow and all that good stuff for them, to try to make it more comfortable to do, like, your quality of life, like your sit to stands or your bed mobility, to be able to lay there and be comfortable and whatnot. A lot of the time, though, it's just trying to maintain the function that they have and let it not worsen. Are you going into a sit again, honey?
When he squats to poop,
Yeah.
he's still like hurriedly walking.
Is he? Yeah.
Yeah.
So he's walking while he's doing it?
Yes.
Yeah. To try to get the mobility.
Does that mean he's in pain, kind of thing?
Not necessarily. Sometimes they'll move and walk in order to actually go to the bathroom to kind of hurry things along, right? Hey, you coming up, are you? You're very sweet, aren't you? Let's see. Good job. Oh, you're sitting again, eh? Okay, let's come up. There you go. You're okay. There you go. I can get underneath ya. There we go. There we go.
It's okay, Pepper.
You're good. Hold you like a little baby. Hey.
How long have you been in physio for dogs?
I've been in physio for dogs now about a year.
Oh, okay.
Yeah. I've been with these guys just for the month. I was doing mobile before, so I was going to people's homes.
Oh, okay.
Yeah. And then I do human physio full time too.
Oh, wow. Also,
Yeah.
just like Sandra?
Yeah, exactly. Yeah.
So you're only here once a week, kind of thing?
Twice a week.
Oh.
Yeah, I'm here Saturdays and Tuesdays, and kind of a little bit of a few things. So, okay, where are you going?
What time do you guys close on Saturdays?
Saturdays, we are here. I think some of the girls are here until like 4-ish. I'm usually here Saturday mornings until about 1. So I start at 9. So they're like my shorter day.
Mm-hmm.
Good job. You're great. I know.
It's okay, Pepper.
Where you going, Pepper? I know. How stressful is this that I got you all trapped in here. Hey? Get this other one. Yeah, those are terrible. Good job. Hey.
So do you have to go to school for
Canine?
like for canine as well?
It's more courses. So Lori here, so with the Canadian Physiotherapy Association, there's an animal rehab division. So Lori runs most of the courses, so the owner of the clinic here. So basically you do multiple courses to get your diploma. Yeah, so it's like additional training beyond like the physio side of things. There you go. Okay.
It must be fun to work with animals.
It's so fun. It's so fun. Yeah, I want to try something with you. I got you somewhere. Okay. Okay.
It's alright, Pepper.
You're okay. You're okay. Just want to give you somewhere if you want to kind of semi-sit. You can kind of sit up on my leg. Hey. Get into the hip again. Okay. 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 Me down this way. And you're down. Okay. There. You're okay. There. Now you can stand, but you can still relax on me. So you don't have to hold yourself up. Okay. Now let's do your hip flexors. Laser it all.
It's okay, Pepper.
You're okay.
Calm down.
I'm just here. It's okay. Good job. There you go. There you go. Hi, sweetheart. You got some good parents that really care about you. Hey.
Thank you.
Good shake. I'll take those off for a second.
Okay.
Hey.
It's okay, Pepper.
You bet you could tell some wise tales, hey. Tell everybody how it's done. Even like him, he was standing out in the waiting room and stuff, which is great. Which is good to see.
Mm-hmm.
Okay. Now you just got your legs up, do you? Okay, we'll do that then. Give you a semi-sit.
Yeah, he was doing that when I was trying to put it in that position at home as well.
Yeah.
I wasn't too sure, like he just kept on trying to lift it up.
I mean, this is kind of a nice way to support his hind end, like, because now he's not as roached through the spine, so if you look here, he's pretty flat. So this is a good way, even like right now, he's wavering through his front end, but to have his bum tucked, then this here just kind of helps flatten out that spine. Yeah. So it's not a bad thing. Yeah. He seems pretty comfortable, like it. Hey. You seem pretty comfy. We'll just do some massage.
It's okay, Pepper.
So good. It's a good sign too that his pelvis is not as off. Yeah. Oh, you're so good. I hear you. I know. I know. Good job. Good job. I'm just mobilizing the joints, that's all, in case you're wondering what I'm doing. Is my hair tickling you? I think it is. If nobody knew any better, they'd say that you were cuddling me.
okay,
Okay.
Pepper.
Okay. Okay. Let's see. Okay. Shh, 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 shh. Let it up and go again. Okay. Let's get this off you. What do we got? Get you all tangled. Get you all tangled.
So Pepper has kidney disease.
Yeah.
If his kidneys are really bad, would it hurt? Do you know? As in, if you applied any pressure?
It's kind of like, so they can't tell us, which is the downside of dogs. But a lot of the times if there's, with kidney dysfunction, with people and stuff, sometimes we'll have experienced back pain, right? So if anything, he'd probably experience a little bit of back pain, but he's not gonna respond with us poking around on the spine necessarily. If I was to really jab in and around, I'm sure it would be tender. Like anything, I mean, he's he's a bit older, so things are more sensitive. That's why we just tend to be a lot more gentler with these little guys. So yeah, it would be more or less, and he hasn't responded to anything that I've done so far. So he hasn't really yiped or gotten angry, or if anything, he just kind of gets annoyed with being in the same spot. He wants to be on the move, don't you? Good job. That's a good stand. There you go. Good job. That was a ooh, you're stepping over and you're down. Okay. You can't stand on that, sweetheart. Come over here. Let's just move that right out of the way and all of our cords. Get going. You can't see where you're going. You can't do that. You can't do that. Now. Good stretch. There you go. Good.
Good boy, Pepper.
You're doing good. I know this is scary. Hey. Better here than the vet. Good job. Good.
Are you just extending backwards,
I
or are you
am.
pulling his?
No, I'm just gently extending his leg, so I'm not putting a ton of pressure. So I'm just basically mobilizing in through his hip, and this helps stretch his hip flexor. So his hip flexor comes right in through here and attaches into part of your spine. So basically when we do that, it just kind of puts it on a stretch, especially now when you kind of look at how he stands. He stands with his legs right underneath him. So typically when you look, if you look at even this picture of the dog here, the myotime chart, a lot of the times the hind limb actually extends back behind them. So his way of just trying to protect his back and stuff is trying to bring that in, and it also helps flex the spine. So it's nice to kind of counteract that by trying to do a gentle hip stretch, just to give him a break from being in that position.
So that stance is the ideal
That's like
stance?
that's like the ideal normal, but we're kind of like, what's normal, right? So he would have stood more like that as a pup. These smaller guys tend to have a smaller stance than a big, large breed. But yeah, it's just kind of helping stretch him out, that's all. Yeah, and that'll help with the spine too. And he really doesn't like his left one done. Hey. There you go. And then we just try to ease into it, so I don't want to do anything that he's uncomfortable with. So just gentle. And sometimes it feels nice. You know how like when they're pups and they do like their yoga poses, so they do their downward dog and their upward dog? Does he still do any of those?
No.
So this is kind of like us doing it for him.
Oh, okay.
Yeah.
When you were pulling it back.
I'm just gently pulling it back. So typically they would go into that big forward stretch.
Right.
So we're just kind of doing it for him, that's all.
It's okay, Pepper.
You're doing great. You're doing so good. I hear you. I know you're frustrated because you can't get over my arm. Good. Good job.
Split hair.
He needs a little bow. Hey. Now I want to see your front limb though.
For his fronts, we have a hard time trying to exercise that.
Yeah.
It's just so stiff.
He's pretty front end heavy. Like you could tell he pulls a lot with his front end just because his back end doesn't want to do the same amount of work anymore. And I know, let's see, you don't like it being bent or anything done with it, do you? There we go.
It's okay, Pepper.
It's a good bicep stretch. So I'm just kind of hooking underneath his elbow and then pulling his elbow back. Okay. Good.
What would you recommend? How many minutes we should spend to do this exercise on a daily
For
basis?
him, from like a fatigue standpoint, the more frequently you can do it, but smaller groups of, that's what I would kind of aim for.
Okay.
So maybe doing like an exercise or two, and then giving him a break, and then after supper doing a few more, making it kind of motivating for him so that it's not complete fatigue. Like he's gonna be wiped after this today.
Oh.
Was he tired after seeing Sandra?
No, he was
No,
really like.
he was more
he watched-
active.
yeah.
Good.
But Sandra did tell me to make sure
Make
he
sure he's
rests.
rest. Yeah.
Yeah, because she said something like he'll think that he can do whatever he wants now.
Yeah. Pretty
since
much.
He seems to be doing well. Also,
Yeah.
But,
Yeah.
yeah, she said it will probably do damage for him or something, like make him more fatigued.
Yep. So we just try to limit that a little bit right off the get-go. Good job.
So I did like a new exercise with him today.
Yeah. Which one was that? Ooh.
So I kind of laid him on his back on like a comfortable pillow.
Okay.
And then I just, cause it's been tough doing some kind of resistance exercises on like the front legs.
Yeah.
And then, so I was also doing the back legs too.
Okay.
So I just kind of laid him on his back and just kind of like, so it kind of, that should be fine.
Should be fine. Yeah. Like one of the ones that we'll even do for them too is like the belly rub belly rub tickles. So if he's laying there and he's comfortable on a pillow and he's okay being that way and you guys can stretch him out, then that's fine. Yeah, you should be okay with that. Yeah. Okay. Okay. Let's see. So when you guys lay him on his side, you lay him there and does he try to get up? Or is he usually pretty happy with being there? Or is he not happy?
We test it out by touching his back.
Yeah.
To see if we lift it upwards, if he tries to move, then that means
He doesn't want to lay down.
correct.
Okay.
Yeah. Until we find a good spot for him and we do that test, then he'll lay still
Okay.
and go to sleep.
I'm just going to try to traction him a little bit here. So all I'm doing right now is if I hold right here, kind of by his armpits,
Okay.
and if I come down his spine and find his pelvis, so where he kind of narrows but then goes wide again, all I'm doing right now is kind of pulling him this way with this arm and a little bit gently this way with this arm. So kind of similar to like the tail pulls, but if you hook at his pelvis, you can kind of gently just counteract. That usually feels really good because it just gaps some of those discs and everything in the spine. So they usually tolerate that fine. You can even do it if you have them up in your arms and you kind of have them underneath, like you're cradling them this way and kind of coming through and then pulling. Some people will even hold them and do it like a stance, but I think he's too fragile for that right now.
Is that the same thing as what Sandra showed me with like the baby thing?
Pretty
Or-
much. Yeah.
Oh, I
Yeah.
see. Okay.
Yeah, so this here is just a different way of doing it if you don't feel comfortable doing that. Yeah.
Okay.
How did that one go?
He didn't seem to mind. I mean,
Good.
his leg would kind of jerk a little,
Yeah.
but then eventually
It would settle.
try
Good.
to, yeah.
Good. Good job. He doesn't seem to mind this at all. I still hear you under there though. I know you're in my armpit.
Also,
Yeah.
sometimes when he stands, mostly his right leg, it starts to shake or
Tremor?
Yeah. Well, do you know what that means?
So sometimes it can be a couple of things. So it could be that he's in discomfort,
Okay.
or it could also be because of with the spondylosis and through the spine, there's oftentimes like a neurological kind of component to it. So you know how when he's walking around, he almost doesn't know where his hind end is that well. So he kind of stumbles around a little bit on the back end.
Yes.
So sometimes what that is just that nerve input is just basically not firing as smooth as what it once did. So that would be my suggestion that it is with it. Are there any tremors? Did he seem, yeah, so right there. So it could just be involvement from the spine a little bit. I wouldn't worry too much about it. We have dogs that are young that do the same thing on the front and hind end.
Really?
Yeah.
Okay.
Yeah, so I wouldn't fret too much about that. The biggest thing is kind of just getting all those stretches and everything done with him.
That tremor started when he was 15 years old.
15? Yeah. And that's probably when things started to progress a little bit more too. When things kind of started.
Yeah, his
Yeah.
right hind leg was stiff whenever he walked,
Yeah.
but only this year in May it just totally crashed actually. His
Okay.
mobility just
Gosh.
totally got shot.
Your body said enough is enough. Hey. I know. You're doing really good. Hey? You're doing really good. I know. He's like, who is this lady? Why does she keep talking to me? Let me see your little elbow here. There you go. I know. There it is.
Good boy, Pepper.
Good job. So the easiest way to, is that the kind of stretch that you're having trouble with, is getting them bent into a full bend, or which one were you having hard with, just all in general on the front end?
On
Yeah,
general.
this is really stiff. He doesn't really want to lift
Bend.
up or anything. Yeah.
So easiest way that you can do it again is kind of coming underneath to support the chest so that he doesn't feel like he's totally off balance. So his, like right now, the strongest part of him are his front end, right? So he doesn't trust his back end. So if you kind of support through here, he won't be as nervous about it. Basically, then what you can do is you can kind of pick them up. You can kind of feel their little elbow right here. So if you hook it around their elbow at the front end and try to bring them up this way, that's bending its elbow back. So that allows me to do a bit of a bend. I can bend his arm up, and then I got him into a full flexion stretch. That's a good stretch to kind of get stretch of range of motion through his carpus, through his elbow, up and through the front of the shoulder. Same thing through the front, if you kind of hold in through the chest again. And then we kind of off weight him so that he's able to. If he has full weight on it, he's not going to want to let you do anything. So that's probably a better part of it, is trying to get that up. He's like, no. So if we off weight him so he feels more comfortable, then you can take him through his elbow. Oh, let's get you doing this again.
Okay, Pepper.
Okay. So if we off weight him this way, then I can kind of pull him up into a stretch that way. Does that kind of make sense? And then I can also off weight him and then pull him up. You're gonna make a liar out of me. Pull him back this way. It doesn't have to be a ton. Like that's stretching. I can feel his bicep going, whoa, I'm not used to being here. So if we do the other side, on move. Okay.
It's okay, Pepper.
So if we kind of look at it again with the elbow, and we try to find that little elbow joint and almost like hook him. You're gonna sit now. Okay. We can bend him. Ooh. This one he might want to bend at the wrist first. Yeah. And your elbow, you're just counteracting me. That's you being rigor mortis right now, saying, no, don't do it. So we can lift him up this way and pull. Oh, that was a good clunk out of your shoulder. That hasn't done that in a while, hey? So stretching him out this way. Same thing, I'm still supporting underneath his chest, pulling him back into a little bit of a bicep stretch. They're not like us where we can bring our arms right behind us. And then if we try to bend him, we can bend him at the elbow. Womp. There you go. And that's as much as you want to do, that's okay. And then at the wrist a little bit. And usually once you collapse their wrist, you can kind of get a little bit more bend, which is good. I know, I'm right here. And then kind of coming out of it.
Thank you.
No worries.
Do you notice if he's kind of dominant on any legs, or if like?
He basically doesn't like his left one mobilized the same, so I think his stronger one and more mobile one is probably his right, and same with his right hip, because I can get more of a hip stretch on his right side, and his left he doesn't want to stretch on that side as well. When you were holding him up, did you find it was his left leg that didn't want to relax?
Yeah, left leg is more stiffer.
Exactly, yeah.
Sandra mentioned that his dominant one is his right.
Right, yeah. Yeah. That's what it seems like. Hey, bud. Oh, hello. Hello.
And the back right leg seems to be the weakest of the two.
The left one, he doesn't want to stretch it at all. But let's just see here for a sec. Okay, there you go. Oh, don't you fall.
Because he
There
keeps
you go.
walking in a
Circle?
but clockwise.
Does he?
And
Okay,
he
clockwise.
falls over on his right leg.
On his right leg more. Okay. Okay, you're
Right?
okay.
Clockwise.
I don't think I've seen him fall.
I
Unless he
haven't.
trips, like maybe on his left.
No, I see it getting tucked underneath. That's why he falls.
There you go. There it is. Beautiful.
Actually, yes. When I extend it like that, his
Yeah.
left leg, he has a hard time doing it.
Yeah.
Less flexible
As the right.
Yeah.
But he does put more weight through the left one. If you're trying to stretch him too, did you have trouble doing this one? Or not as much?
Not as bad as
Okay.
the left one.
Because it's easier for him because he actually has like fairly stable on the front. So if you kind of gently lift him up, then you can kind of do that big stretch back. To off weight and then lift him up a little and stretch that one. And he doesn't like that one as much. You're not allowed to go face planting on me. Back here. Okay, I hear you. Sometimes what you can do too, through the ribs, to try to get some mobility, is basically if you feel, I'll get you to feel right here. So you feel all the little bumps that his little spine's process.
Mm-hmm.
So if you kind of if you kind of put your hand on one, almost like a little pinch grip,
Okay.
and hold it there, I can lift up a little bit on his rib cage, and that helps gap that joint a little bit.
Oh, so I should like pinch
you
it.
can
is
kind
that
of
it?
like pinch it down, but just kind of hold it so it doesn't move a ton. And then as you mobilize, as you kind of lift up his rib cage gently, that's a good mobilization for the spine too. And it's typically pretty easy for you guys to do because you don't have to be super specific with it.
Oh,
so
okay.
all you do is kind of find a bump,
Mm-hmm.
kind of hold your finger almost like a little pinch grip. You don't have to pinch it very hard. I'm probably doing this amount.
Oh, okay.
That's all. He's tiny, and then basically then you're pushing up on the chest that way.
Okay.
On the rib cage. Sorry, my phone is, I thought it was on silent. I'll just stop you right there. And then you're kind of just mobilizing up that way. And that's all. Let's do that one. Where are you going, bud?
And do I do it along his whole?
Do the whole spine, yeah. Until you've kind of stopped the rib cage, right? Because his rib cage stops about here. And then in this position, he's standing, but a little bit supported underneath too. So that was kind of the same when I had him over my other leg. It just makes it easier for you guys to do them.
Could you do the same thing in the back if you kind of lift up his legs, the hind legs?
Yeah.
I think and do that.
Kind of, but then that's really kind of putting him in a lot like more extension, which he might be uncomfortable with. So that's why kind of that traction piece to that lower part, right? So either that tail pull or then kind of that pelvis pull.
When you do that pelvis pull, do you
Yeah.
lift anything towards his ribcage?
Not lifting per se as much as I am pulling this way. So I'm kind of just gently stabilizing, so I'm not letting him move. And then as I pull down, that's when we're getting the gapping.
Okay.
So it's kind of just that gentle pull. I'll show you on your wrist so you know how much to do it. And you can try these after too.
Sorry, Pepper.
You're doing so good.
He looks like he gave up.
He did. He's like, oh, I
His
take
eyes.
it now. I get it. Also, traction feels good.
Good boy, Pepper.
You're doing so good. Oh, no, he said, I'm still here. Nope. You still got fight in you left, hey. It's okay. You're doing so good. Can I see if I can plump this shoulder too for you? Good job. Good. Okay. Here we go. So whichever one you guys are comfortable with doing, kind of gently supporting in through, oh. So supporting, so this one spine is a little bit flatter. He's not as kind of hunched. And then you can do that gentle tail pull that way. That one was okay for you guys?
Yeah.
Yeah?
Mhm.
So the other one is, like I said, if you support here and tuck underneath his chest, so kind of like his armpit area. So if I hook his armpit just to kind of stabilize and I follow his rib cage down, he gets narrow,
Mhm.
and then you butt up against bones right here. So as you butt up against bones, you're gently going to basically stabilize here and give a gentle pull. Okay? So I'll probably get you to do those ones so you feel comfortable with it. I'm pulling it about, I'm going to pull on your hand. So if I'm stabilizing one and I'm pulling the other, I'm basically pulling it like that.
Okay.
So not that crazy. So I'm more
Is
like,
that like the tail?
it is,
Oh,
yeah.
okay.
So basically kind of pulling down, but you're hooking it at the pelvis bone instead. So it's just going to be a little bit more specific to higher up. Okay? Boop, 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 boop. Okay.
Okay, Pepper.
Let mom try.
Sweet.
Good.
Is it this way?
Yep. Hello. Meow. Oops. Sorry.
Okay.
It must be hard when you can't totally see what's going on, hey bud? You're just like, who's picking me up?
So you
Yeah.
hooked.
So I'm basically underneath here, so kind of tuck underneath his armpit. Good. Good. And now follow his rib cage down. So feel how wide his ribs are right here.
Yes.
And then you see how it narrows.
Yeah.
So you feel those bones right there.
Yes.
So you're going to hook your hand here and you're going to gently pull.
Oh, I see.
And it just makes it a little bit easier.
Oh,
And he
yeah.
seems to settle when he's into it. He doesn't seem to mind it at all.
How long do I hold it?
So typically with the tail, like same with the tail pulls, you kind of typically want to try it for 30 seconds. It can be something that you kind of hold for a few seconds and ease. It's kind of like it mobilizes it. So kind of think
I
of it as
see.
like a wave if you want, or if you will. So you don't have to do the complete full 30, but if you wanted to kind of ease back and forth and do it over the sake of like a minute, you could do that.
Okay.
And then typically in this position, he seems like he's pretty comfortable.
And it was like downwards kind of thing.
Totally. Yeah.
Okay.
You're kind of pulling it towards his tail.
Good boy, Pepper.
Yeah.
Good boy.
Good.
Oh, okay. That seems pretty easy.
Pretty easy. Yes. So that's a good one for you to do. In this position too, because he's here, you can kind of support him and do his hip extension. So if you kind of think about where you are, think about where you are. So if you wanted to kind of lift him up a little bit through his bum.
Okay. It's all right.
And then instead of, so kind of here, and then you would pull him back. So actually, let's get you in a better position.
Oh, like this?
Yeah. There we go, bud. There. So then that makes it easier for you because you're off weighting his hind end.
Okay.
And then you're kind of pulling him right back into a stretch. Good.
Oh, his left leg only?
Yeah.
Oh.
Right now his left one. And then you can do his other one. And this is also a way to do his three-legged stance.
Oh, okay.
Okay? So you're kind of double whammying it.
I see. Okay.
Good.
It's all right. It's all right, Pepper. Good boy.
Good. And then you can try the other leg if you want in that position too.
So I can just hold it back like
You
this.
exactly, yeah.
Oh,
So it just makes it a little bit easier.
it's okay, Pepper.
You're doing great, bud.
Come on.
You're doing good. Perfect.
It's
Good.
all right. Good boy, Pepper.
Good.
Okay.
Now, let's get him over towards you. And now if we wanted to do his front limb. So what you would do is you're going to kind of come where I am to support. I'm kind of supporting him right underneath his whole chest. And then I'm coming, ooh. You can either hook if you want to. So at least then he's not falling or feeling like he has to be totally supported. And you can support your hand right on your thigh. And then what you're doing is as my hand's underneath here, I'm shifting his weight. So I'm shifting it towards the right leg.
Okay.
And then I'm pulling him up. So that means now he's technically doing a three-legged stance with a little bit of assistance, which is allowed. And then
So he's standing up with his
yeah,
hind legs?
he's standing up.
Okay.
Yeah, except for now he's trying to step over me, which is a good exercise for you. Then the other thing that you could do is if you're off weighting towards the right, you pull him back. And then you can also try that full bend and kind of hold it. So you just hook his little... And as long as you're off weighting it, usually they're pretty okay with you doing it.
Mm.
Yeah. So off weighting,
Good boy, Pepper.
and then bending up.
Another exercise I've been doing was, I'm not sure if it's hurting his back now I think about it, but getting him to stand on my hands with his hind paws.
Yeah?
And he would balance like that. But that means it's kind of raising his back a bit. I'm wondering, would that hurt him?
It'd probably be best if you were to do it in that position. So remember how I had him like this? So if I have Pepper this way, and I get him
It's okay, Pepper.
here. So right now, now you're falling. So right here, he's in a bit of a crouch. So he's balancing, but if you see here, his spine's a little bit flatter, right? Because it's just kind of counter. And it'll be less nerve-wracking for you to be holding him on both your hands. So kind of use your bigger muscles in your legs to do this stuff because he's so small that you can use all of that to help mobilize him. So if I'm pulling him back here, and then he's in that flat spine.
I see.
Yeah.
The idea was for him to build muscle.
Yeah.
And that would help with the muscle.
This is going to help with core control too, though, right? And this is going to help with mobilizing the spine. So any of those three-legged ones are going to help build muscle, right?
Okay.
So this one is just kind of helping flatten out his spine so that he's not in that full roach position, right? Okay. Now, if you wanted to try those rib ones that I had you doing, so remember how I said
yes.
mobilize? Yeah. So same sort of thing. If you want to kind of hold him over your leg, you can.
Come on. Good boy, Pepper. Good boy.
Good.
So it was like.
So basically what you're
Slight pinch.
doing, so what you're doing is you're going to come underneath with your hand right under his rib cage. So you're going to cradle him.
Okay.
Yeah, good. And then what you're going to do is you're going to find his little bones. So you feel that? So what you're going to do is you're going to apply about, I would say, this much pressure.
Okay.
And then at the same time, you're going to lift his rib cage up
Oh.
and then relax.
Up this way, was it?
Right directly. So you're
Oh, okay.
basically doing this motion.
Okay.
So it's like a tiny one and then up.
Mm.
Up. Because whatever you're lifting then is going to actually lift those ribs around it. But then the joint that you're stabilizing is going to be the joint that that gapping's happening at. Okay? There you go.
Oh, so his paws are not touching the ground?
Doesn't matter.
Okay.
Yeah. Yeah.
Just like,
You got it. Yeah. Here's a point. Exactly. Yeah. So just that gentle mobilization.
and just up to the ribcage.
Pretty much. Yep. And then that's when you would do your tractions. When you get down here, kind of pulling on that pelvis like you were
that
doing
thing.
before.
That's right.
Yeah.
Okay.
Okay.
Good boy.
Good. So, and then we had you doing cookie stretches. So she said basically going up towards the ceiling with a cookie stretch and then coming over to the shoulder.
The problem is that he can't seem to look up, but he
Yeah.
can do
He can do the sides.
Yeah,
Perfect.
and a
So
bit
you
on
do
the
what he
bottom.
can, right? The other thing too is in that position right now, you could even gently, if you wanted to, kind of give him a chin scratch, right?
Okay.
So that's going to get him looking up. So anything like that to get him into that extension.
So some exercise I do
Yeah.
for his neck.
Perfect.
I hold it up.
Good.
Just like that.
Yep. Nice and gentle. Yeah.
Okay. And
Good.
Then turn like this.
Totally.
Is that okay.
Yeah. You're basically a canine physio.
Okay, just want to make sure I'm not straining.
You're
because-
not. No. As long as everything's nice and slow and controlled, they usually let you know if they're really resisting, right? So that would kind of be, that's totally fine to do. Like, you can even, if you really wanted to, with him. So if I'm supporting underneath his chest again, and then I have him underneath his bum, I can technically do a little bit of a side bend.
Oh, is that right? Oh, okay.
Really gentle. So I can side bend him, and that's going to help stretch out all those muscles along the back too.
Okay.
Okay? So I'm basically just holding him up through his rib cage, and then turning his little bum. Okay?
Okay.
And that's just kind of hooking and doing that. And then that's when you would still do those hip stretches. Yeah, you can do all that together. He actually tolerates it really beautifully.
That's good,
Yeah,
right?
it is
Okay.
good. Yeah. Okay. Good. Good. You just got done over by the physio. Hey. Good job.
Usually for the effects of the laser, like how long does it usually last for?
I mean, technically, like, we will do, for like from a maintenance standpoint, we'll usually do like a once a week kind of thing. Sometimes too, like I know the girls, the assistants will do laser. They'll do, I think it's like $40 a session. So people you can just pop in and just do laser too, which can be helpful as well in between it all. But even now, like, did he typically sit a lot before? Or
No.
not really?
Only in the last month he was able to sit.
This is good. This is
Before
good.
He couldn't sit down.
And like this is a nice sit. He has both of his legs tucked. He's obviously feeling well enough to do it because otherwise he
Oh.
wouldn't do it.
Okay.
Yeah.
So he would always stand up.
Would he? Yeah.
Yeah.
So, and as long as he's supported, like, do you guys have rugs and stuff around the house and everything?
Yes.
Yeah. So like that there, he seems like he's pretty well comfortable with what he's doing. Hey.
And just like what he's doing, he's kind of leaning over. Eventually, he'll fall over.
He'll fall over.
And
yeah.
he won't be able to
Get back up.
Mhm.
But if you guys are here supporting him,
Right.
then that's okay to do too, right? All those positional changes and stuff, and then even helping him get from a sit up to a stand. So kind of helping with that transition so that he wants to be able to do it on his own. Very good.
It's okay, Pepper.
Yeah. And up. Up, 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 up. Oh, good job. Good.
If we do, like, you know how you sat him down and then you got him to
Yeah.
stand up? Is that an okay exercise to try to get him to like get up on his own?
Totally, yeah. Mimicking all those exercises, so mimicking all the like the bed mobility and the sit to stands are all helpful. Even here, like we can get into sit down, sit, 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 boom. Now you sat. That's a good boy. And then I come underneath, and I'm on his little hamstrings, and we're saying underneath here, underneath his chest, up, 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 up. So that was him. That wasn't me.
Wow, I see.
Yeah.
Okay.
That wasn't me. That was just me saying up, up, up with his hamstrings.
Okay.
So facilitating and kind of massaging it or rubbing it to get him to stand.
So we can do that like a few times just as an exercise for him to.
Yeah, you
How many
can.
times do you think we can do it?
I think for him, like 5 times throughout the day, 3 to 5 times, what he can tolerate. I wouldn't do like multiple in a row. Like try for one and see how he does with it.
Okay.
Yeah. But you're obviously okay sitting here right now. Hey. Good. Good. You're a rock star. You're a rock star. Don't tip over. It's a good balance
Can I
exercise.
try the up thing?
Yeah. So if you're underneath them, so kind of hook underneath here, and then say go up, 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 up,
Pepper.
up, up, up.
Good boy. Good boy. Pepper.
Good.
Good boy.
There you go.
Oh, I see. Okay.
Yeah. Good.
Okay. Good.
All right. That's a good boy.
So what is it? So these kind of mats, it's like electromagnetic.
Yeah. So I'll show you guys up front.
Does it ease any pain at all?
Yep.
It does.
Yep. Yeah. I'll show you guys the one up front so you can see it. At least you have a video of it all.
Yes.
I know it's a little bit all over the place, but you guys can crop it out.
Yes. Thank you.
Could he actually even sleep on it?
Yeah.
Like throughout the entire night, and it's okay.
Yeah. Yeah. We have them going. We have them. I'll show you up front so you can see. Here you go, bud.